Hello and welcome. Let's talk about antidiarrheal agents. So, what are the main aim and objectives of treatment? Preservation of the fluid and electrolytes, treatment of the diarrheal cause. Now, management of acute diarrhea. Most diarrhea are self-limiting and the management depends on establishing the underlying cause and instituting the specific therapy. Now, correction of the fluid and electrolyte balance is the most important, and antimicrobial agents and adjunctive includes antidiarrheal, antimotility and anti-secretory agents and zinc supplement. Now, correction of the fluid and electrolytes. The most important management to replace fluid loss, and it may be life-saving. The normal daily fluid intake is 1 to 2 liters and the fluid loss in diarrhea is isotonic. During diarrhea, a source of the carbohydrate, either starch or sugar, is required to absorb fluid and electrolytes. This is the basis of the oral dehydration salt. Now, ORS with hyperosmolarity. Composition includes sodium chloride 3.5 gram per liter, potassium chloride 1.5 gram per liter, and trisodium citrate or dehydrate 2.9 gram per liter, or sodium bicarbonate 3.5 gram per liter, and glucose anhydrous 20 gram. The trisodium citrate made the sodium solution more stable and resulted in less stool output. Trisodium citrate increases intestinal absorption of sodium and water. Hyperosmolarity of the solution can cause adverse effects, so now it is not used. Now, new ORS formulation. ORS with lesser osmolarity 245 millimole per liter. Composition includes sodium chloride 2.6 gram per liter, potassium chloride 1.5 gram per liter, trisodium citrate or dehydrate 2.9 gram per liter, and glucose anhydrous 13.5 gram per liter. This ORS preparation is safe, effective, decreases stool output, decreases osmolarity, and so avoids possible adverse effects of the hypertonicity or net fluid absorption, so increases efficacy and causes lesser IV therapy, lesser stool output, and lesser vomiting. The rationales of ORS treatment: best, simple, safe, cheap, easily available, very effective, reliable, and only ORS can control vast majority of the water diarrhea. Now, parenteral therapy. Intravenously, it is given especially to the children and recommended only when the fluid loss severe or more than 10% of the body weight, or unable to take enough oral fluid due to shock, vomiting, or weakness. Now, parenteral therapy. WHO recommended IV fluids are ringer lactate solution, which includes sodium 130 millimole, chloride 109 millimole, potassium 4 millimole, lactate 28 millimole. Diarrhea treatment solution includes sodium chloride 4 gram, sodium acetate 6.5 gram, potassium chloride 1 gram, and glucose 10 gram per liter. Now, calculation of the appropriate volume for replacement of the fluid. Replacement of the established loss. In an adult, average losses of the fluid in moderate diarrhea with 48 hours duration 1 to 2 liters, and any associated vomiting is extra fluid. So, fluid 1 to 2 hours liters given rapidly as ORS or parenteral. And calculation of the appropriate volume for replacement of the fluid includes replacement of the ongoing losses, which is 200 milliliter of the isotonic fluid, and replacement of the normal daily requirement, which includes 1 to 1.5 liters. Antimicrobial agents should not be routinely used and used only in specific infections, which includes drugs like quinolones, cotrimoxazole, ampicillin, doxycycline, tetracycline, erythromycin, metronidazole, and others. Adjunctive therapy includes contraindicated in the management of the infective or potentially infective gastroenteritis. Antimotility agents includes loperamide, diphenogxylate, which is dangerous for children. Anti-secretory agents includes bismuth, anticholinergic agents, anti-spasmodic agents includes atropine, adsorbents like kaolin or charcoal, which is of no value, and zinc supplement is given because it reduces the duration, severity, and incidence of the diarrhea in the following 2 to 3 months. Now, dose. According to WHO or UNICEF recommendation, infant under 6 months 10 mg, and children more than 6 months 20 mg for 10 to 14 days is given. For in case of the bloody diarrhea or bloody dysentery, antimicrobial agents and ORS is given. End of the topic.